Well, hello everyone. My name is Suzanne Dara. I'm Associate Professor in Swansea University and I'm the Programme Director for Health and Social Care. So I'm online today to talk to you about the degree at Swansea University studying Health and Social Care. I suppose the first thing to say is that it's an honours degree, so that is a good degree. It's not something to be entered lightly, but you're likely to enjoy it, particularly because of all the subjects that we offer. If you're someone who's interested in looking after people, taking care of people who've got challenges in relation to their health and or in relation to their living situation and their social situation, this is the course for you. The sort of careers that people who do health and social care go on to do, all the careers related to medicine and nursing, and all the careers related to social work, and what we do is we provide a very sort of general course that covers all of the subjects that you'll need to work in those professions. One thing to say though is that many of these professions will require you to do a further course, and those courses will sometimes be at master's level, but really when you think about it, what you'd be doing is working in a very responsible position. So this course is the beginning of that journey into becoming a health professional or a social care professional. So a little bit more about the course then. What would you do? The courses start at the end of September and they run for 3 years. In year one, you'd study several courses, several modules with all your friends. So we all study them together in year one, and they include things like human biology, psychology, sociology. We also look at things like social policy, like what is the government doing in order to help people in healthcare and social care situations. You'll study how to research things, how to find out what's best for people and how to help people in the best way. Also in year one, we help you with a course on academic writing, because at university, I suppose you'll understand, you'd have to write essays as well and do exams. So we offer a course on academic writing, which guides you to how to exactly do what's needed for university work. At the end of year one then, you have a bit of a break over the summer and you start again the following September, end of September, entering into year two. And when you go into year two, you get a choice of modules. So you can choose to go more along a sort of a health path, where you do perhaps more of the bioscience, human biology, that kind of thing, looking at how to care for people in relation to their health. Or you might choose a path where you'd study more social care subjects, looking at things like safeguarding and law and things like mental capacity. Some students go along a bit of a middle path where they choose a bit of both, and there's not a problem with any of those. You can still enter different professions with this degree, whatever path you followed. But of course you can choose your own path and think about things you're interested in particular. I think one thing that most students really like on this course is the placement opportunity in year two. So halfway through year two, you'll be able to have a placement, which is a 10-week placement, 1 day per week for 10 weeks. You go to places such as working with housing associations, working with children in schools, working with youth workers, with mental health charities. There's all sorts of different placements. We have a list of them and we ask you to choose the ones that you would like to go to and make an application for that, and then you can take that placement opportunity. Lots of people really enjoy that, and it's very good in terms of thinking about, sometimes people work out what they don't want to do by having been on the placement. They think, well, they do quite like that, but that's not really for them. So it's a good opportunity to think about what you want to do in the future. Of course, there are other students who go on the placements and absolutely love it and end up getting jobs in those placement areas when they finish the university course. So I've talked a little bit about the careers, and the next thing to think about is, what sort of courses could you do after that? Well, there are lots of master's courses in Swansea University and in other universities and in other organisations that you can take after studying this honours degree. What will it be like when you come to Swansea University to study? Well, I've already said that in year one you share with all your friends and you study the same courses, same modules in year one. The class size is usually somewhere between 30 and 40. So you'd be studying initially in year one with 30 or 40 people. In year two and year three, because you've got options for different modules, the classes may be smaller or they may be larger. But on the whole, you'd study with around 40 people. I think one thing that's really important for me as the leader of this course, I've been a healthcare professional in the past, I'm still actually on the register as a midwife, but I don't teach midwifery anymore, I teach this course. So I'm really aware of what we need in health and social care in the country at the moment. What we need is people who can work on behalf of their clients. So in the future, when you finish the programme, you'll be entering into a profession in the health field or the social care field, and you'll be working with vulnerable people. So we expect you to be able to know how to find out what's best for those people, how to help them to live in the best way possible, and how to improve their situation as best they can. So you're going to be a very important person in many people's lives. So in order to do that, you'll need to know how to find out what is best. How can you work out what's best for people with them? So we need you to learn about things like law, about their mental capacity, about ethics, about research. How do you research what's the best for people? How do you know what's best? So part of that will be related to reading. So one of the things I always say when I talk to people who want to come on this course, it is about a practical application, it's about a practical job, if you like, in the future, but a lot of it as well is about knowing things and being able to find things out. So right from the very beginning, we're going to be guiding you to do a lot of reading. We're going to point you in the direction of the right kind of things to read and helping you to read things critically. So I think when you come on this course, you'll need to be someone who's keen to find things out and who's keen to learn. So one of the first things I was thinking about to ask you to read is there's a really good book that we recommend on this course for people before they come along, and it's called Health Studies. It's quite a simple title, Health Studies, and you might be thinking that it doesn't have anything about social work or social studies in there, but it does. It's an excellent book. By the way, I haven't written it. It's written by two people called Jenny Naidu and Jane Wills. But if you have a look at that, find that and have a good read of it, it'll give you everything you'll need to decide whether you want to come on this course. It'll also be very useful throughout the course for you. The other thing to think about is if you're going to be studying a degree, we really think that you're going to be the leaders of the profession going forward. So, for example, if you're going to work in elderly care, there are lots of problems at the moment in the country in terms of elderly care. Do people have the best care? Is it best for people to be in institutions or in their own home? Do we know what's the best way to help them live a healthy life for as long as possible? Well, you, with a degree, and possibly even with a master's, if you follow on with a master's, are going to be the people who are going to be making those decisions in the future and helping people to decide what's best for our civilization, if you like. This is getting really big now, but for the future. So we really expect you to be leaders, people who are going to be able to rise to the challenge. Of course, we don't expect that at year one, day one. That's what the whole course is about, is to help you to work through all the modules you're going to study, take advantage of all the help that's on offer, read all the recommended reading, work together, because a lot of the stuff we do is working in groups, because of course in the future, even though you're a leader, you'll be working in a group, leading that group. So there'll be lots of chances for you to work with your colleagues, to do projects and to do assignments together. So we would expect people to want to come on this course who are going to work well with other people. And of course, when you're looking for employment in the future, one of the things that employers look for is that you're able to work with others and to lead them. So I think I'm just about to finish up now, and I think the best thing I can recommend you do is have a look at that book, look at our website, think about coming along to one of our open days where you're going to be able to talk to lecturers and to students about the course, so make your decision. And also look at the study@swansea.ac.uk site so that you can make some inquiries and find out more about Swansea, about healthcare, social care, and all the courses that are available here at Swansea. I look forward to seeing you at the open day, and if you choose to apply to Swansea, I look forward to seeing your application and then seeing you start the course. Thanks very much. Bye.